Today we will discuss on the topic pharmacovigilance terminology. Before that, we know about what is pharmacovigilance. Pharmacovigilance is derived from two words, pharmakon and vigilia. Pharmakon is a Greek word. It means drug and medicinal substance, and vigilia is derived from Latin word which means to keep watch. So, what is the definition of pharmacovigilance? According to the WHO, it is the science and activity related to the detection, understanding, assessment, and prevention of adverse reaction to medicine and any other disease related problem. Then we see what is drug. Drug is any substance that are intended for the treatment, mitigation, cure, prevention or diagnosis of any disease or disorder. Then next we see adverse event. Adverse event is also called as adverse experience. Adverse event, it is any unwanted, unfavorable, untoward medical occurrence in a patient who are on the therapy of suspect drug, which may or may not be suspect drug. It is also defined as it can be any unintended or unfavorable signs, symptoms associated temporarily with the use of any drug. Then what is ADR? ADR means adverse drug reaction. Any response to a drug which is noxious, unintended, which occur or dose normally in a manner of prophylaxis, diagnosis or therapy of disease or modification of prophylaxis or modification of physiologic function. For example, cough, vomiting, diarrhea. Then what is vaccine pharmacovigilance? Vaccine pharmacovigilance is the science and activity related to the detection, assessment, understanding and communication with adverse event following immunization related with the vaccine immunization issues. Then what is the concept of day zero? It is called as initial receipt date, or it is also called as awareness date. The original date on which the company or its employee or affiliates partner where the first case reported satisfying the minimum valid criteria. This term is called as day zero or awareness date. Which are the minimum valid criteria? Now see, there are four minimum valid criteria. First is identifiable patient. In this we have to know about patient age, gender, initial, their hospital number, and second criteria is suspect medicinal product, means any drug which caused by ADR is called as suspect medicinal product. Then third criteria is identifiable reporting source. It can be our family member, name, contact information, patient address. Then four criteria is we have at least one adverse event, which means the outcome or severity. Then what is side effect? Side effect is an unwanted or undesirable effect of result. We also, it is defined as it is undesirable physical symptoms caused by taking a drug or undergoing medical treatment or therapy. For example, diarrhea, constipation, skin rashes, headache. These are the example of side effect. Then what is unexpected adverse reaction? Adverse reaction, the nature or severity of which is not consistent the applicable product information. Then we see what is serious adverse reaction or serious adverse event. or it is also called as serious suspected unexpected serious adverse reaction, an adverse event which result in death, life threatening, medically significant, require hospitalization, or require prolongation of existing hospitalization, consisting of a congenital anomaly or birth defect. What is meant by life threatening? It means a serious adverse event or a serious adverse reaction refer to an event which at the risk of death at the time of event. Then what do you mean by severe event? Severe event means it is used to describe the intensity of a specific event. It can be mild, moderate, or severe. Mild means when we are feeling not well, for example, when our headache, then we took medicine to relieve the pain. After some time we feel better. It's the example of mild. Then moderate means in moderate we have to take 2 to 3 days of treatment to cure our health issue. In severe it is also it can be life threatening. It can affect on health. Then we see what is healthcare professional. Healthcare professional means medically qualified person such as doctor, pharmacist, nurse. These are specified by local regulation. Then what is marketing authorization? Marketing authorization means the company that regulate permission to manufacture and market a product in a given country or region, and therefore the legal responsibility to comply with the pharmacovigilance requirement holder. It is called as marketing authorization. Then we see what is consumer, a person who is not a healthcare professional such as patient, lawyer, uh, relative, parents, or children. Then what is suspect drug? Suspect drug means any drug which cause of PDR. PDR means adverse drug reaction. Then what is non-suspect drug? Non-suspect drug it is also called as concomitant medication. In this, any drug or medical devices or other than the drug. Then what is past drug? Past drug means which were the drug which were discontinued or completed prior to the start of treatment with the suspect drug. Then what is meant by counterfeit medical product? Counterfeit medical product is one which were deliberately and fraudulently mislabeled of with respect to the intensity or prior identity and or source. Then what is drug dependence? Drug dependence means a physical or physiological phenomena making repeated use of drug compulsive. Then drug dependence generally occur after a patient has taken a drug for a long time and or an high dose. Then what do you mean by overdose? Overdose means more than twice time dose recommended in the product information document. Then what do you mean by medication error? Medication error is any preventable event that cause or lead to inappropriate medication use or to patient harm while the medication in the control of the healthcare professional, patient, or consumer. Then what do you mean by drug abuse? Drug abuse means excessive use of drug or any substance which is very harmful. Then what do you mean by drug interaction? Drug interaction is one of the drug upon efficacy and toxicity of one or more other drug. Drug interaction include drug food interaction, drug alcohol interaction, drug device interaction. Then we see Then what do you mean by lack of effect? Any failure of expected pharmacological action is called lack of effect. Then what do you mean by placebo? Placebo means a drug, a treatment is appear real but is designed to have no therapeutic effect. We see. Then what do you mean by off-label use? The drug prescribed for condition other than the approved by the FDA. Then what do you mean by open label trial? A clinical trial in which the doctor and participant is know about the drug or vaccine is being administered. Then what do you mean by IBD? International birth date, the date of first marketing authorization of the medicinal product granted by the marketing authorization holder. Then we see what is DLP means data lock point. The date designed as the cutoff date for the data to be included in a signal detection report. Then we see what is signal detection. Signal detection is a signal reported information on a possible causal association between the adverse event or the drug is called as signal detection. Then what do you mean by IND application? IND is the filling form to the FDA for conduct clinical trial on the human. Then we see what is NDA. NDA is filling the information. NDA means new drug application. NDA filling the application to the FDA means Food Drug Administration for marketing of the approval of marketing of new drug. Then what do you mean by OTC? OT means over the counter drug. These are those drugs that can be sold directly to the people or patient without prescription. Then what do you mean by prophylaxis? It is treatment given or action taken to prevent disease. It's called prophylaxis. These all are the important terminologies in the pharmacovigilance. Thank you.